Welcome to the first episode of this series, What IVF Clinics Don't Tell You, by the Eggsperts. We are a team of medical researchers who dedicate our efforts to investigating the mysteries of infertility. I'm Lachlan and I'll be hosting this series. As a bit of background, I'm a PhD student looking into different aspects affecting the quality of eggs in the ovary. Most of us have heard of IVF or even know someone who's gone through the process. But have you ever wondered how successful it really is, or what it actually entails? Today, I'm going to talk through where we're at with reproductive technology, where it's heading, and what it can actually do for people trying to conceive. There are a lot of misconceptions out there about the process and what it offers. So in this series, What IVF Clinics Don't Tell You, we're going to unpack the trends, the best practices, and the not-so-good ones in the industry. All around the world, we're seeing less people choosing to have children when they're younger, or even choosing to not have children at all. This has led to a decline in rates of childbirth to below what we call replacement levels. Essentially, the number of births needed to maintain or increase the population of a country. Most countries, including Australia, have below replacement fertility levels, and it's been this way for a lot longer than you may think. We've actually been below replacement levels since the 80s. There are plenty of reasons behind this trend, from people simply choosing to pursue career ambitions and financial goals, to not having found the right person, to issues from other factors such as age and maybe even environmental exposures. If you're curious to know more about how things like aging or plastic affect fertility, make sure to check out our other series, Fertility and Aging from Brendan, as well as Plastics and Fertility, brought to you by Alex, where we dive deeper into those topics. Whether it's due to one factor or a mix of them, when a couple has trouble conceiving, usually after about 6 to 12 months, they might start wondering if there are other options. And that's where assisted reproductive technologies come in. Now, I know the term assisted reproductive technologies sounds a bit clunky and clinical, but a lot of different procedures fall under this category, and chances are you've heard of some of the big ones, like IVF or egg freezing. These are just a couple of the many options available, and the option that's best for someone comes down to a person's circumstances and why they're exploring fertility treatments in the first place, as some are better tailored to female factor infertility and others to male. About 20% of the time, we don't actually know why a couple is experiencing infertility, but what we do know is that male and female infertility are almost as common as each other. It's important to include the experiences of transgender, non-binary, and intersex people when talking about reproductive health. I also want to acknowledge that terms like male and female don't always align with how everyone identifies. For clarity in this discussion, I'll be using male and female when discussing types of assistive reproductive technologies, but I recognize that these terms don't capture the full diversity of people's identities and experiences. These technologies have become increasingly common in countries such as Australia and New Zealand, which had over 100,000 assistive reproductive technology cycles undertaken in 2022, a rate that has been increasing for a few decades now. As a result, 1 in 18 children today are conceived from assisted reproductive technologies. Right now, the two biggest methods on the market are in vitro fertilization, or IVF, and intracytoplasmic sperm injection, known much more simply as ICSI. Both of these techniques are leading types of assisted reproductive technologies and have advantages for different circumstances. In an IVF procedure, the ovaries are stimulated to encourage the body to produce multiple eggs in a single cycle, eggs that the body has naturally created but might otherwise have developed one at a time. This stimulation typically involves a series of hormonal injections or oral medications, administered over the course of about 2 weeks. These medications are designed to support the growth and maturation of multiple eggs. The process is closely monitored through blood tests and ultrasound scans to track the body's response. Once the eggs have reached the appropriate size, the final trigger injection is given to prepare the eggs for collection. Around 36 hours later, the eggs are retrieved in a short day procedure called egg collection or egg retrieval. This is performed by clinicians using a gentle suction technique guided by ultrasound. On or before the day of egg retrieval, a sperm sample is either provided by the individual's partner or, in cases using donor sperm, thawed and prepared by the laboratory. The sperm sample is processed to isolate the highest quality and most motile sperm, which are then combined with the collected eggs. Fertilization occurs in the laboratory under the care of embryologists, who closely monitor the development of the embryos. The goal is to create as many healthy embryos as possible, as a higher number increases the likelihood that some will be suitable for transfer or future use. If fertilization is successful, the embryos are cultured for approximately 5 days, allowing them to reach the blastocyst stage, a point at which embryo quality and potential can be better assessed. At this stage, an embryo is selected for transfer into the uterus. Any additional embryos that are considered viable can be frozen or cryopreserved for potential use in future IVF cycles. This provides the opportunity to attempt pregnancy again without undergoing another full stimulation cycle. After embryo transfer, there's a waiting period of about 2 weeks to determine whether implantation has occurred. At the end of the 2-week wait, a blood test is performed to assess whether pregnancy has been achieved. Sometimes, however, people run into issues with the fertilization process through problems with either the sperm, the egg, or even both. And when this happens, we need to look into other options, and ICSI is one that can help with this. ICSI is a specialized form of IVF used to assist fertilization when there are concerns about sperm quality, quantity, or function. The process follows the same initial steps as standard IVF: ovarian stimulation, egg retrieval, and sperm collection or preparation. Where ICSI differs is in the method of fertilization. Instead of allowing sperm to fertilize the egg in a dish by natural selection, an embryologist selects a single healthy-looking sperm and injects it directly into each mature egg using a fine needle under a microscope. This delicate procedure bypasses many of the natural barriers to fertilization, increasing the chances of success when sperm may not be able to penetrate the egg on their own. In the case of male infertility, we generally see more use of ICSI to mitigate things like irregular sperm shape or movement. ICSI is also the way to go if the egg has previously been frozen. Couples attempting assisted reproductive technologies for the first time using their own fresh eggs and sperm without male factor infertility should ideally start with IVF for better rates of success. But this isn't always the case, which we'll come back to. While ICSI definitely provides an option for people with certain fertility issues, it comes with the catch of not allowing for the usual selection process that takes place before fertilization. You might have heard people talk about the race that sperm have to the egg, but it actually isn't as simple as that. Eggs have a thin layer which kind of acts like a shell, which surrounds it after it is either ovulated or collected for assisted reproduction. That shell plays an important role in choosing which sperm fertilizes the egg, so that it's given the best shot at embryo development. It also prevents multiple sperm from entering by going from a spongy texture to a condensed one as soon as the egg has been fertilized. That shell will continue to protect the embryo for several days as it travels onward toward the uterus. While sperm with better movement and shape are chosen for the ICSI procedure, we can't really predict why an egg might be more selective to certain cells, which could make the early days of embryo development more of a challenge when we take that selection away. People might choose to freeze their reproductive cells to set aside for later for all sorts of reasons. Maybe they're focused on their career, haven't met the right person yet, or have a family history of conditions like premature ovarian insufficiency or PCOS, or because of conditions like cancer, and they need to preserve their eggs so that they aren't damaged during treatments like chemotherapy. They also might be choosing to donate these cells, in which case they won't personally be using them at all. In these cases, freezing eggs, sperm, or embryos gives them a bit of a time capsule. The eggs stay exactly as they were when frozen, even as the person continues to age, which sounds like a win. Well, sort of. There is a catch. The freezing and thawing process is often somewhat stressful for the cells. In some cases, it can cause damage, which might impact their viability. While this isn't usually enough to derail the whole process, it's an important detail that's easy to overlook when someone's caught up in the bigger picture of planning for their future. It also means that because someone freezes these samples when they're younger, it doesn't mean that they are guaranteed to have success down the line. While assisted reproductive technologies like IVF and ICSI were originally developed to support couples facing infertility, they've also opened up new pathways for same-sex couples and unpartnered female patients, not necessarily because of infertility, but because they require access to sperm or eggs outside of their own relationship, and together they make up about a third of all cycles. Because of this, the types of technologies available and the reasons you might pursue them are slightly different. For female same-sex couples, one of the most commonly used options is intrauterine insemination. This is a bit more straightforward than some of the techniques I talked about earlier. In this procedure, the donor sperm is placed in the person's uterus. No time in the dish required. It's less invasive and often less expensive than IVF, which is a much easier option for people who aren't necessarily having issues with fertility. Alternatively, another increasingly popular choice is reciprocal IVF. In this process, one partner provides the eggs, which are fertilized with donor sperm, and the other partner carries the pregnancy, allowing both partners to be involved in the process. For male same-sex couples, having a child typically involves working with both an egg donor and a gestational surrogate, that is, someone who carries the pregnancy but is not necessarily genetically related to the child. One or both partners provide sperm, which is used in IVF to fertilize the donor's eggs, and the resulting embryo is transferred to the surrogate. Surrogacy can also be used for female patients unable to carry pregnancy due to factors like autoimmune conditions or conditions affecting their uterus. In Australia, surrogacy isn't a very common process. Only 100 to 150 births happen from this procedure in a year. These paths to parenthood aren't always easy, and often involve complex logistics, high costs, and varying legal frameworks around surrogacy and donor rights, depending on where someone lives. But they reflect a growing recognition that families come in many forms, and reproductive medicine is evolving to support that diversity. Ultimately, assisted reproductive technologies aren't just about overcoming infertility. They're also about inclusion, offering people of all genders, sexualities, and relationship structures the chance to build a family in a way that's right for them. And as access to these services continues to expand, we'll likely see even more stories of new definitions of what it means to bring a child into the world. Thanks for listening to this episode by the Eggsperts, hosted by me, Lachlan. Be sure to tune in to the rest of this series as we look into the global stats on assisted reproductive technology trends and look into IVF add-ons and whether these are actually improving assisted reproductive technology rates. Also be sure to check out our other series, Debunking Fertility Myths, Unwrapped, Bite-Sized Sex Ed, Plastics and Fertility, and Fertility and Aging. In our next episode, we're going to go into some further detail about fresh and frozen techniques. What's better and what does better actually mean? The answer might be more complicated than you think. Stay tuned for more episodes on the Eggsperts.